here to raise alarm with healthcare professionals and allies about the potential cuts and proposed privatization of the Department of Mental Health and Addiction Services. Most of us know family members or friends in need of mental health and addiction services. Helping people to overcome these problems is a sound investment. It saves money, and in the long run, it is more importantly, it saves lives. As a society, we recognize the need to provide pathways to recovery for those facing mental health issues. We can see the damage being done by the growing opioid crisis in Connecticut, and we know we need to find ways to remedy this problem. But closing down the most advanced programs in the public sector is not the answer. Doing that would be a disservice to all Connecticut residents. Privatizing or cutting these services will remove current staff who have experience, training, strong relationships with the lives of people who need them. These services and relationships cannot be replicated. The mental health and addiction matters should be addressed robustly in our public and private sectors. Instead of debating where we can cut or transfer services to save a buck here or there, we should be talking about finding the revenue to fund all of the services that are currently provided in Connecticut, and we should be looking at ways to expand and add more services to protect vulnerable populations in our state. Thank you. Today you will hear from a young man from Portland speak about the Young Adult Services Program and the workers he has built relationships with him. That program is getting totally wiped out in this budget. It's a program that now has 41 beds, and it's getting totally wiped out in this budget. You'll hear from 3 professionals today besides that young man. The first from Western Connecticut Mental Health Network in Torrington, a lead mental health agency that coordinates and delivers care in Northwest Connecticut. Our other 2 healthcare professionals are lead mental health agencies in the state's largest urban centers, Bridgeport and Hartford. And right now I'm going to introduce our esteemed state senator from Danbury, Julie Kushner.
Thank you. I'm so glad that you're all here today, and I want to thank my colleague, Senator Saud Anwar, who is himself a health professional. He's a doctor, and so I really appreciate you standing with us today because I think you understand the importance of these issues, and we need your support, and we really appreciate it. But I do want to talk about Danbury because I've lived in Danbury for 25 years, and now I'm the state senator from Danbury. And I've met the folks that work at the Western Connecticut Mental Health Network. And I know the kind of work that is done there. And it seems criminal to me that in this time in our state, we would even think about closing an agency like this. Now, these are dedicated workers who have been out on the front lines for a very long time, some of them 20 years, making connections with the people in need in our community. You know, they serve 19 towns in the Danbury area, so it's not just like this is a center that is serving Danbury. This agency really is the sort of the centerpiece for all the services that are being delivered. When I tell you the kinds of work they do, it's astounding. I mean, they do crisis intervention. They have joint response, coordinating with the police and with other agencies in the area to deal with crises in the community. They work with formerly incarcerated persons to make sure they transition back into society. They have clinical outpatient services that they provide. They do transitional residential. They help people to transition into residential living. They're staffed 24 hours a day. They provide young adult services to people 18 to 25 who are transitioning out of DCF. And essentially, when I say they're on the front lines, maybe I should say they're in the trenches or on the streets, because I know that the workers in this program go out onto the streets and they locate people who are in need, and they meet with clients, and when there's somebody that doesn't show up for an appointment, they go out and find them. And they are the ones that can make the connection with people that they've built long-term relationships with. Now, one of the most important things about this program is the concept of continuum of care. You can't just drop anybody in any time and think that they're going to be able to effectively deal with mental health issues of the client. Because you have to build the relationships to get through to people. And that's what these workers have done. Now, I mentioned to you all the work that's being done. I do want to let you know that there are 19 social workers, 4 mental health assistants, and 2 doctors that work on site. They don't get paid a lot of money to do this. Social workers make $39 an hour. These are professionals who have been trained and are certified. Mental health assistants make $29 an hour. You know, this is not, you know, like they're getting rich out of doing this work. People are doing this work because they love the work and they love the people they care for. So what really drives me crazy, what's the bottom line here, is that by closing this agency in Danbury, you know how much money the state's going to save? About $1 million. And I don't think we can buy this kind of service for $1 million any other way. And so it doesn't make sense. We're at a time where mental health services are really at the top of the list of things that we need to make sure we're taking care of here in Connecticut. We know there's an opioid crisis. We know that we have mental health issues that have really hurt us in our communities and keep our communities from being strong. And these are the folks that are working on this on the front lines. So I have your back. I feel like this is extremely important to our community. I know that the people in our community thank you and appreciate the work that you're doing every day, and we're going to be here to support you. And it's time to say, don't close these facilities. Let's keep them open and let's make sure they can do the job that they've been hired to do.
Thank you, Julie. Not only is Danbury being closed, the Torrington office is being closed, an office in Bridgeport is being closed, Hartford, New Haven, about 1/3 of DMHAS basically is going to be closed down with these cuts. And I would suggest we're not going to save $1 million or $6 million because we're going to be creating crises elsewhere. Next speaker is Alex Perfetto, and Alex actually he lived at the DMHAS program in Portland, which is going to be closed. And so Alex has some words for us.
My name is Alex Perfetto. I'm someone who's been in the mental health system since I was 10 years old. I was diagnosed with bipolar disorder. I was diagnosed with Asperger's syndrome at 13. Went into DCF at 15 and transferred to Young Adult Services at 18 years old. I have been through a lot of things, and Young Adult Services, when things really start to turn around, what they offer is, it can't be, explained. From someone, it's a very hard thing. But what Young Adult Services provides and the consistency, things start to turn around. I work with CLS, which is Community Living Services, which is a part of Portland, and River Valley Services. And I'm someone,
Got a lot of friends here.
yeah, I know. I've been working since I was 18. The Young Adult Services has provided transportation. They brought me to work on third shift for 6 o'clock, and
Thank you.
It's kept you going.
Thank you, Alex. Okay, next speaker is from Torrington Mental Health. Again, one of the facilities that's going to be closed, and it is Cynthia Krauser.
Talk to you guys. I've been a clinical social worker with the Department of Mental Health proudly for 20 years. I currently work at Western Connecticut Mental Health in Torrington, which is one of the LMHA's lead mental health agencies that is being proposed to be closed and privatized. So I'm here to speak out against this proposal to privatize Torrington and Danbury. We currently service people who need mental health services and addiction services, and I believe this senator said there is 18 towns that Danbury covers. We also cover 19 towns in the northwest corner, some very rural areas where people need mental health services. We're responsible for clinical, fiscal, administrative oversight of state-operated and contracted private agencies providing mental health agencies. I just want to say that there is definitely a place for the private nonprofits. We work with them, we need them, but we also provide much of the clinical oversight for them. Many times we do a lot of, I guess, just helping them. We work together well. I also work for Mobile Crisis. Part of our job in Mobile Crisis is to be out for the entire community. We do not just work for people that are involved with the Department of Mental Health. We have an excellent relationship with the Torrington Police Department as well as the state police, and we just continue to look to make that relationship even more, make it thrive even more. So many of us have worked at Torrington for decades. We have extremely trained and dedicated professionals. Again, like I said, we experience crises that we deal with on a daily basis. We've also, there's so many things that we're involved with, and some of the state programs that we oversee are the Acute Psychiatric Grant Med Program, Community Support Programs, Recovery Pathways, Jail Diversion Program, the Acquired Brain Injury Program, Young Adult Services, which again is being slated as the gentleman who spoke before me very passionately said, many of them are being slated to be cut. We have amazing recovery and wellness programs that are helping people to be a part of the community and learn skills and just make their lives so much more rich. Residential support services, employment services, getting people back into the community to be a part of the communities. Psychosocial services, outpatient services, transitional housing services, again, getting these people living in part of the community. Homeless outreach services. And we do oversee 15 privately contracted 8 programs. There's so much more, and I don't have time to tell you. People in Connecticut with mental health issues and addictions need more services, not less. Please do not disrupt the care we provide by destroying the structure that is working. Separating people who've responded to emergencies together for years will make things worse, not better, for those who need mental health and addiction services. Privatizing our services will turn the current functioning system upside down. We call on the state legislator to fully fund DMHAS services as they are provided now. Thank you very much.
Thank you, Cynthia. Next person that's going to speak is Susan Kelly, and Susan is the Director of Advocacy and Policy for the National Alliance for Children's Mental Illness, otherwise known as NAMI.
I'm here.
Good morning, everyone. Thank you so much for having me here. I want to thank each and every one of you for your hard work and dedication. You're on the front lines, and I always feel great when I'm able to be with you all and take this opportunity to talk about the importance of mental health issues. And thank you, Senator Anwar and Senator Kushner. So the health and well-being of Connecticut residents is the foundation for a strong workforce and economy in Connecticut, and it helps make our state a desirable place to live. Achieving overall mental health isn't possible for our state residents without maintaining a strong behavioral health system. And the budget cuts to DMHAS as well as the Department of Public Health over the past several years have chipped away at this essential foundation. There's been a decrease in access to care due to budget cuts, while at the same time the need for mental health services has grown, and we are in the midst of a opioid crisis. Private providers have had to cut back services, and in order to meet the needs of both on the mental health and the substance abuse sides, we need federal funding, which we are getting. There's a lot that has come into our state, but we need state funding too. So how do we keep this foundation? Well, we need to prioritize mental health and substance abuse services, and how do we do that? By growing revenue and earmarking and identifying sources for to keep and grow services and meet the needs of many of our most vulnerable citizens. And prioritizing also means keeping in place a continuum of care. I can't emphasize enough how important that is, and you've already heard a lot about the services in that continuum. There's residential, group homes, transition services, young adult services, housing and employment. These are all things that help to keep people functioning in their communities, and this is good fiscal sense. It is a good investment, and it is going to save money and improve health outcomes. And how does it improve health? How does it save money? It's going to keep people out of the emergency department. It keeps people out of getting entangled in the juvenile justice and criminal justice system. Early intervention in those young adult services are critical to helping youth and young adults achieve recovery and maintain recovery, and that means lower costs over the terms of their lives. And workers stay in their jobs and miss less days of work. So I wanted to also talk briefly about housing, because sometimes housing is people don't associate that with necessarily keep an effective behavioral health system, but housing is critical especially for the chronically mentally ill, and supportive housing, which entails wrap services to help keep individuals stable and keep them in their housing over the long term, and keeping them and helping them thrive in their communities. And finally, I just want to also emphasize again the investment in the mental health of youth. That funding adult services means more young adults are going to be able to thrive as adults. And the school-based health centers, I just want to put it out there, they're funded by Department of Public Health, but they provide essential, 40,000 students get care, both medical and mental health care, through school-based health centers, and they've been experiencing cuts for many years, and this really affects low-income children and underserved communities where they can access services the best through schools. So again, thank you, and we need to maintain an effective behavioral health system for the vitality and strength of both the economy and our state. Thank you.
Thank you, Susan. And our final speaker is a head nurse who works at Capital Region Mental Health. Capital Region Mental Health has had services cut through the years, and now they want to cut an entire unit at Capital Region, and again, where we need to expand. And Melanie MacArthur is a head nurse over there.
Good morning, my name is Melanie MacArthur, and I've worked for Capital Region Mental Health and Addiction Services for 13 years. I'm currently employed in the inpatient treatment unit at Capital Region, where I provide mental health services for Hartford residents diagnosed with chronically ill mental illnesses. The inpatient unit is a 16-bed inpatient treatment, operates 7 days a week, 24 hours a day, focuses on the care of the people who are uninsured and cannot obtain services from other providers. Our unit provides a broad range of services, including helping patients integrate back into the community, teaching skill building, helping patients obtain Medicaid and Social Security. We refer them for testing. For instance, we refer them to occupational therapy to identify skills and deficits for living independently. We refer them to neuropsychological testing if necessary. We provide individual, family, and group therapy and help connect them to community resources. Most importantly, we help them transition into the community settings and work closely with nonprofit community providers to ensure safe, smooth discharges for our patients. On an average, people stay in our program for about 180 days. Without us, patients and families with limited resources and access to services would be without help. Let me put this into perspective for you. Currently, people in the ER have a wait time up to about 2 weeks for an inpatient bed. There is no wait time for our unit. Many times, hospitals such as Institute of Living and St. Francis rely on our facility to care for our patients who require further hospitalization in an inpatient setting. Many times, homeless patients who are discharged end up in shelters, and many times that leads to rehospitalization or, in the worst case scenario, incarceration. At Capital Region's Mental Health Inpatient Unit, we have a policy against discharging to shelters. If our unit should close or be privatized, many Hartford area residents will be put at risk. Most private facilities do not deal with the severity of our clients in which we serve and will not know our clients as well as we do. I am here today to urge legislation to fund Capital Region Mental Health Center's 16-bed inpatient treatment unit and all other DMHAS services. We are passionate about our unit and our patients. This is a unit that is greatly needed in our community and in the capital city of Hartford. Families play an important and critical role in the treatment as they attend our weekly treatment plan meetings, help us understand our patients better, and play an important role in discharging them. They even come during their lunch breaks, they walk to our facility, and it will be devastating to our patients to close. We have already cut too much in the mental health and addiction services. We have nowhere else to cut. Thank you for your time and your consideration.
Thank you, Melanie. Any questions? Yes.
Questions for the senators. Senator Kushner, I believe you met with the governor last month, or maybe it was February, so I'm wondering if this was a topic of conversation with him.
Well, when we've met with the governor, obviously there's a lot of topics on the agenda, but I think clearly one important topic that we've been discussing is how do we generate more revenue to make sure we can provide all these services. And I think that we have to be creative. I think we have to look at how do we create a much more progressive, a fairer system for collecting revenue in the state, because we know middle-class families are really hurting. And I really do appreciate Paul, when Paul sort of corrected me when I said we were projecting savings of $1 million on this closure of Danbury, because it's not savings of $1 million, because they're going to have to spend that $1 million elsewhere, whether it's providing it through nonprofits or whether it's dealing with the outcomes that occur when you don't have the services to begin with. So I apologize, because I should have made that very clear, that there is no savings in closing these facilities. There's no savings in cutting this budget, because the state of Connecticut is going to pay in so many other ways.
I can just add to that too.
Sure.
Thank you for that question. I think the value statement is that a society is judged based on how we treat the most vulnerable people. And at a time in our society when we are identifying that the most vulnerable in our community are increasing and the needs are increasing, we actually are shying away from our responsibility by expanding the services, but actually moving away from the expansion by reducing it or eliminating it. Now, there's a lot of data on the fact that when somebody has mental disorders or other behavioral disorders, their medical problems are increasing. We will be seeing a lot more people in the emergency room, in the hospitals, and admissions. And then guess who's going to pay for it? We as a society will all pay for it, so it's not going to be of any savings. So this is actually a very knee-jerk reflex in my mind. It is not well thought out, because if it's intended to save money, there is nothing that to show that it's going to save money in a sustainable fashion.
Could you say
The legislature has the power to reverse these cuts with your own budget, which you're working on in the Appropriations Committee. So will your budget fund DMHAS fully?
Well, I know that I'm on Appropriations Committee, and we were asked by the chairs to inform them and to work through small working groups on where the need is to adjust the budget proposals that have come before us already. And this is one area that I have actually highlighted, because I feel so strongly that DMHAS really needs to preserve the funding, and so it is something that we'll be looking at very closely.
And what are some of the private nonprofits that may step in to provide the services in the absence of some of these deals?
They're all called the League: Danbury, Torrington, Norwich, Hartford, New Haven. They are the lead mental health agencies. And what they do, they interface with all the private sector agencies and put that care together for that particular region. And so it's not just like we're closing a facility. We're closing the cog that keeps the mental health activities together. And so when people are showing up at the state facilities, they can be put into the right needs that they have. And so absent that, we don't believe there might be a couple of agencies that can step up, but most of them are smaller agencies, and they just don't have the expertise and the numbers that you need to run a city.
And I can tell you in Danbury, I know that when I've spoken with the folks that work at the Western Connecticut Mental Health Network, they do the coordination. So can you imagine a system that we're setting up of nonprofits that don't have anybody coordinating it? So if there's no coordination of the delivery of care, it's going to be a huge mess. The other thing I know from them is that they do things that aren't done by the nonprofits. So they go out on the streets and they find clients that are in trouble, that haven't reported in or haven't been at an appointment. They don't just say, okay, that appointment was missed. They actually go out and find people, and they've built up the relationships so that there's trust. So when they find that person, they can bring them back in. These are things that can't be replaced.
I'll just add one sentence to this. This is complementary management. The nonprofits complement the basic management, but they, in my mind, are not ready to take on the entire role, but they can complement in the process, and they have been doing a great job in the complementary part, and that can be expanded. But you don't take the actual central part of the management away.
So you've listed a number of towns and service providers that are going to be impacted by this. Who has created this list of cuts? Are you referencing a specific list that's been drafted by DMHAS already?
Well, it's the Commissioner of Mental Health gave this proposal to the Appropriations Committee.
Can you step up to the mic, please?
The Commissioner of Mental Health put this proposal together, I assume, with whoever from the governor's office, and they came before the Appropriations Committee about 3 weeks ago, I would say. And so that's where the proposal came from. Anything else?
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.